In today's video, we're going to be talking about how to treat the most common cause of an itchy groin, jock itch. Let's get into it. Jock itch is a really common fungal skin infection caused by a group of fungi called dermatophytes. Dermatophytes live on our skin and don't usually cause any problems, but when there is an overgrowth, this is when you get jock itch. It causes symptoms such as itchiness, burning, flaking, and a rash, usually of circular appearance with raised edges. The colour of the rash can be red, purple, grey, tan or white, depending on the colour of your skin. There can also be blisters near the borders of the rash. The rash usually starts in moist areas such as the creases of the groin and can spread to the upper thighs and the buttocks area. It rarely affects the genital areas such as the penis or scrotum in men or vulva in women. Anything that causes more moisture in the area is a risk factor, such as athletes, being obese, wearing tight-fitting clothes, staying in wet bathing suits for too long, and being male, as the area between the scrotum and thighs tends to trap a lot of moisture in there. Jock itch can spread really easily, so if you have tinea in any other areas such as on the feet, or if you come in contact or share clothes or towels with someone who has tinea, then you are more likely to catch it. If you have a weakened immune system or have uncontrolled diabetes, then you also have a higher chance of developing jock itch. Usually, a doctor will be able to diagnose it just by looking at it, but occasionally they may need to take a skin scraping for further investigation. It's best to treat jock itch as soon as you get the symptoms, as it usually doesn't go away by itself and can spread easily to other areas. The good news is treatment is quite simple with over-the-counter products and should fix the problem within a few weeks. So start with an antifungal cream such as clotrimazole, miconazole, bifonazole or terbinafine. The creams need to be applied once or twice a day depending on the ingredient. Just follow the product packaging. The jock itch should start to clear up within 1 to 2 weeks, but the important thing is to continue treatment for at least 2 weeks after symptoms disappear. If you don't do this, there's a good chance that it'll come back. Now, if the jock itch is super itchy, then you can use a combination cream containing an antifungal and a mild steroid such as hydrocortisone 1%. This will help to treat the jock itch as well as reducing the inflammation and itchiness. Apply this twice a day for a week, then continue with just the antifungal without the steroid until the symptoms go away and for at least 2 weeks after symptoms disappear. Make sure not to apply any creams containing a steroid to any open wounds. And definitely don't use the steroid cream by itself, as it can make the condition worse. If you find these treatments don't work, it may be because there's too much moisture in the area. You may find it beneficial to use a barrier cream containing zinc oxide, which helps to control the moisture. Now, you might find this strange, but you can actually use a nappy rash cream which will contain these ingredients such as zinc oxide that provides the barrier. You can also find creams that contain a combination of both the antifungal and the zinc oxide, so you don't have to use 2 separate products. Ask your pharmacist if you're unsure. Another tip, if you find there is a lot of moisture using the antifungal creams, is to use an antifungal gel or powder instead. Just keep in mind, if there's any broken skin, the gels can sting. So the ultimate treatment for jock itch is if these don't work, then speak to your doctor, as there are prescription options you can try. Tip number 1, keep the area dry. Always dry the groin area with a clean dry towel after you shower or sweat. If you sweat a lot, you can try using a powder or an antiperspirant in the area. You can find antiperspirants such as aluminium in roll-ons and some anti-chafing creams. Ask your pharmacist if you're unsure. Tip number 2, avoid spreading fungal infections from other areas. If you have a fungal infection on your feet, then make sure to use a separate towel to the groin area. You also need to be careful when you're putting your underwear on. The underwear can easily touch the feet and spread to the groin. In this case, ideally you would put socks on first before you put your underwear on. Tip number 3, wear breathable underwear. Synthetic fabrics are often not very breathable and may cause more moisture in the area. Wear cotton or other breathable fabrics. Loose boxes will also help to keep the area dry, as opposed to wearing tight briefs. And tight briefs can also cause more chafing. Tip number 4, change clothes regularly. Change your underwear and clothes every day, especially your workout gear. Tip number 5, avoid soaps. Soaps can dry out the skin and cause irritation. Use a pH balanced soap-free wash to wash the area. Number 6, diet. Eat a balanced, healthy diet to improve your immune system. And reduce sugar in your diet, as too much sugar can provide the optimal environment for fungus to grow. Eating probiotic-rich foods such as kimchi and yogurt may also help to reduce the overgrowth of the fungus. Tip number 7, if you're diabetic, keep a check on your blood sugar levels. Work with your doctor to get your blood sugar levels under control, as higher blood sugar levels can lead to fungal infections. Tip number 8, avoid picking up fungal infections from other people. Don't share towels or clothes with other people, especially if you know they have a fungal infection. Always wear thongs in public showers and around swimming pools, as you can easily catch foot fungus from these areas. So that comes to the end of our video. If you found anything useful in this video, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!